Good day. My name is Lady Sarah Cadano, and I am here to discuss my FMA 34.C208, which is Communication, Social Marketing, and Mobilization. So, in this report, I'm going to discuss Ating Dibdibin program, which is also known as Take Your Breast Care to Heart. It is a community based program that helps women learn about breast cancer and get free or low cost screenings. We know breast cancer is one of the leading causes of death among women in the Philippines. Many women, especially those in poor or remote areas, do not have access to proper information, screening, or treatment. Because of this, breast cancer is often found too late when it is even harder to treat. This program focuses on early detection, education, and support, especially for women who normally cannot afford these services. By identifying the frameworks, women can now learn how to improve their health and also give them better understanding about the situation. So first is we have to identify the problem. So what's the problem that is being discussed in this program? The problem is that breast cancer is leading causes of cancer-related death among Filipino women, but there is a lack of awareness, accessibility to screening, and education in rural and underprivileged areas. The problem is compounded also by cultural barriers and insufficient healthcare infrastructures in certain regions. So we already identified the problems and now we have to know the people. For this, the target group is Filipino women, especially those in rural and underserved communities. The main people who benefit from Ating Dibdibin program are those who live in faraway areas. These women often do not have money or access to health clinics. Some of them may also lack knowledge about breast cancer and are also afraid to get checked because of fear or shame. By understanding who these women are and what their struggle are, the program can create better ways to help them. For example, they can offer free checkups, give talks in local language, and make sure that information is simple and easy to understand. This helps build trust and encourages more women to join the program. Next is identify the helpers. Ating Dibdibin works with many partners like local government units, LGUs, doctors, nurses, hospital, health centers, NGO, and volunteers. These helpers give medical services, organize events, share health information, and help reach more people in the community. Working together makes the program more effective. Next is set clear goals. So I want to discuss the goals that was discussed in this program, which are to increase awareness about breast cancer, to encourage women to get screened early, to offer free or low cost breast exam and services, and to reduce the number of late stage breast cancer cases. By having clear goals, the program can focus on its efforts and track its success. Next is we have to plan activities. The program offers many helpful activities such as free clinical breast exams and referrals for mammograms, health talks and seminars in communities, distribution of educational materials, training for health workers so they can teach others, and mobile clinics that go to remote places. That is my favorite one. So these activities are planned based on what the community needs most. Next on my framework is share the message. To reach more women, the program uses different ways to share information. This includes full posters, flyers, radio ads, social media, and community events. Messages are delivered in Filipino or local dialects so everyone can understand. Campaign encourages women not to be afraid or to take care of their health. These activities, of course, cater what women needs most. So we are still on the Share the Message, and this program actually achieved significant success in raising breast cancer awareness and improving early detection across various communities in the Philippines. And here are some concrete examples of its impact. You can see the university outreach. For your information, in November 2024, the program reached over 360 students and staff at Fisher Valley College in Barangay Agonoy, Taguig. Participants learned about breast cancer, received training on breast self-examination, and heard from breast cancer survivor who shared her personal journey. This initiative is part of Ating Dibdibin Goes to University Caravan series, aiming to educate younger generations and faculty members about breast health. We can also see the picture. This is actually a part of their second phase of Ating Dibdibin Goes to University Caravan. So, over 360 students also participated, and then they also received a recognition in 2024. They were honored with Galing Poak Award by the Department of Interior and Local Government. This award recognized the GEG's comprehensive implementation of Adding Dibdibin program, which is highlighting its effective strategies in breast cancer awareness and early detection. They also trained the health workers in Muntinlupa. 200 barangay health workers received a training on early breast cancer detection, including clinical breast exams and patient navigation. This training enhances the capacity of local health workers to identify potential cases and guide patients through healthcare system, ensuring timely and appropriate care. Last on my list on this framework is check the result always. Many women have already joined the program and got screened. Some cases of breast cancer were found early, which gave the women better chance of treatment and survival. Feedback from the community has been positive. The program continues to grow and reach more areas, showing that it is making a real difference. As we can see on the previous slides, the program and even the award received was a proof of excellence and effectivity. Beyond formal training, I think they've been organized numerous community events, including free breast cancer screenings, educational workshops, and distribution of informational materials. These efforts have been instrumental in reaching women who might otherwise have limited access to healthcare services. These outcomes underscore the program's commitment to fostering a culture of proactive health awareness and its pivotal role in reducing breast cancer mortality through education and early detection. To conclude, we can say that Ating Dibdibin program is a strong example of how community-based health programs can save lives. By focusing on early detection and support, it helps Filipino women, especially those in poor and far places, take better care of their breast health. With the help of local governments, health workers, and volunteers, the programs continues to grow and reach more people. Real research like training health workers, holding free screenings show that the program is truly making a difference. With the continued support, I think they've been can help reduce breast cancer cases and give more chances to a healthier life. Thank you so much for listening, and I hope you are having a good day. Thank you again.